member from Don Valley East.
Thank you very much, Madam Speaker. Thank you. I'm pleased to rise in the chamber today to speak to Bill 60. I'd like to point out at the outset that I'll be sharing my time with the member from Kingston and the Islands. I couldn't agree more. Anyways, I'd like to begin this debate by just pointing out something that the member from Simcoe Grey just remarked, which is that Medicare has 4 principles. And that's not true. Medicare has 5 principles, and the one that he missed out was accessibility. And for as long as there are fundamental differences on objective facts, like the number of principles that we hold dear in the Canada Health Act, then it is just not credible that this government can be trusted to manage public health care in the first place. Anyways, Bill 60 remains the latest in a series of poorly conceived, superficial policies lacking the thought, detail, or any semblance of understanding about the challenges in our healthcare system. It continues in a series of failed policies, like the failed effort to increase credentialing of foreign-trained healthcare workers, the failed effort to regulate temporary for-profit nursing agencies, and the failed effort to reassure us that Ontarians will always pay with their OHIP card, not their credit card. We don't need to look further than virtual primary care to discover already that OHIP services are locked up in this province behind paywalls and credit cards already. So, as a brief overview, what's wrong with Bill 60? Number one, it completely misses the point of our healthcare crisis. Notably, it doesn't address any of the challenges with our health human resources. It doesn't address the massive underinvestment in our healthcare system under the current government. That's number one. Number two, it only pays lip service to the things that actually matter in our healthcare system: oversight, protection against upselling and upcharging. It pays lip service, but it delivers none of the details and leaves far too much to the regulations. And finally, I will say that it has failed even before it's passed, because we are seeing for-profit corporatization across our healthcare system to the detriment of our patients and having surgeries and procedures addressed in a timely manner. So this government loves to rail against the status quo without acknowledging that they are the status quo. The moment they took power 5 years ago, our healthcare system embarked upon a significant nosedive. They cut hundreds of millions in public health funding. They cut staffing solutions like the Practice Ready Assessment Program for foreign-trained family doctors. And they enacted the unconstitutional and wage-constraining Bill 124, which they continue to support and to now appeal in the courts, to the cost of millions of dollars to the citizens of Ontario. Bill 124 is a rate-limiting step that is preventing us from enhanced performance of our healthcare system. And for those that don't believe me, I invite you to consider this quote from the Ontario Hospital Association, that very same organization that this government loves to go to when they need quotes to support their policies. And I quote, "The OHA has consistently advocated that Bill 124 should not be extended, nor should additional restrictions be imposed due to its impact on availability of HHR and other impacts on hospital operations." That's from their buddy. It will come as no surprise then, because they have persisted in defending Bill 124, that Ontario Health data reveals under the Ford government our healthcare system performance has been the worst in this province's history, ever. And to be clear, every year of this government's so-called leadership has resulted in worse performance than the last. What I'm here to argue today is that rather than throwing the baby out with the bathwater, what we need to be doing is moving our healthcare system from neglected from the current government to protected. Let's also not forget that by 2028, this government will have underinvested by over $23 billion, according to the Financial Accountability Office. And I have heard that the government contends they disagree with the FAO, but I will also add that this opinion simply can't be trusted, considering their own estimates of this province's deficit swings by billions of dollars every few weeks. So amidst this comedy of incompetence, we have a murky new bill whose impact really won't come into focus until it has passed, because so much of the stuff that matters isn't actually in the bill and is instead left to regulation. Who, for example, will perform the oversight? Is that body external or internal? And without such details, how could we possibly believe that there are credible protections against upselling or overcharging? After all, this government has insisted throughout the entire year that upcharging isn't actually even a problem, though the Auditor General has said that it is, and instead ignored her recommendations while reassuring us that everything is okay. Madam Speaker, this bill really could have spent some more time cooking in the oven. For example, in Schedule 2, the definition of nurse is thrown out the window and instead replaced with the following. Registered nurse means a member of the College of Nurses of Ontario who holds a certificate of registration as a registered nurse under the Nurse Act 1991, or another person prescribed by the regulations. So the definition is changing, but we have no clue what that definition will be. It is simply left to the regulations. How can we have a discussion about redefining an entire profession without any details about what that will be? The reality is that this is likely an approach to introduce as-of-right legislation without affording anyone an opportunity in this legislature to have an actual debate about it. So I'm going to talk very briefly about moving surgeries out of hospitals. There is some merit, there is some precedent that in Canada and around the world, surgeries can be moved out of hospitals. But in order for that to be successful, it has to be done with adequate guardrails. Most importantly, time and time again, we have learned that not-for-profit initiatives consistently outperform for-profit ones. And this is not an ideological position. Apart from the fact that it has been demonstrated in journal after journal after journal, it is also the position of the Ontario Medical Association. In their report on integrated ambulatory centres in 2022, they made it clear that their position is that such centres should operate on a not-for-profit basis. And so they should be not-for-profit, and they must have credible protections against profiteering, upselling, and siphoning of healthcare workers out of the publicly funded system. Bill 60 doesn't do any of these things, and instead it leaves massive gaps. Until such gaps are credibly filled, this bill is nothing more than window dressing and does nothing but threaten the quality of healthcare in this province. With that, I yield the remainder of my time to the member from Kingston and the Islands.